Today we're gonna introduce Dr. Lillian Khan to talk about skin glow and during, of course, quarantine, or actually during all the, in general. So now, if she can, thank you so much.
Hello,
Hi, how are you?
I'm good. How are you? Thanks for
I'm
having
good.
me.
Thank you. Welcome. So today the topic is about skin glow, uh, the natural skin glow, since your clinic is based on that, because you told me that you're like to you're famous for no makeup, no filter.
No filter, no makeup. Yes, this is our
No
hashtag
filter.
actually.
So how can we do that actually?
We focus on the skin. This is
Yeah.
how you can get it because most of the time women don't like to come out without makeup or there's so many people use all the time filters, and I try as much as I
Yes.
can never to use filters, no matter how I look that day, just to promote the self confidence. And they get it actually through good skin. If you have good skin, then you don't feel like you need to put on makeup, and you're more confident to come out without using any kind of filter. Because what are we trying to do with the filters is that we're trying to mask any imperfections that are there in our skin.
Yes.
So that's the focus of the clinic, and this is what we focus on, is treating the skin itself and any problems within it.
So
How?
for a woman to get this natural skin glow, what are the techniques, or what like I would say, what is the routine that she can follow to get this? Like, is there any particular thing, especially nowadays, everyone is like like free during quarantine, so
It's true, and this is what I'm trying to promote. I've been more active actually on social media in the since the quarantine started, because I feel like this is the best time for us to catch up on things that we didn't have time for, and especially the skin, because the skin usually takes a long time for it to respond. It doesn't show the results very quickly, and this is why a
yes,
lot of
true,
people
true.
give up on treatments, or they opt for doing quicker procedures in order for them to get that quick effect. Whereas when you're working on the skin, when you're working on your hair, it takes longer because the skin takes longer to rejuvenate, the skin takes longer to respond. The creams, we have to be careful when we're using them that we don't harm the skin. So in order for us to do that, it's like it takes almost a month sometimes to start seeing results in a lot of our patients. Now, usually my approach towards skin and this is the approach that I take when the patients come to me. First of all, we address the things that bother them the most. So basically, when I examine her, I give her the mirror, and she has to tell me what bothers her the most when she looks in the mirror after she washed her face in the morning. And that's the first thing we try to address. So مثلا تقول لي الحبوب اللي في وشي، او التصبغات اللي موجوده، او مثلا التجاعيد هذه اللي موجوده فيه، or the sagging of the skin if she's an older woman or a maturing woman. So basically the first thing that I try to do is address that problem first. And then we start addressing the other thing, because sometimes it's several things that cause her to have that effect. So for instance, she's telling me the colors of my skin are not clear, and it's usually not just one problem. It's not usually just pigmentation or scarring. It's usually there's pigmentation, there's scarring, there's telangiectasia, which is giving it the brown, white, and yellow hue to the skin. And we actually have to address each one, and each one has a different modality of treatment.
Different treatment. Okay.
Yes, exactly. So this is the first thing that people need to understand, is that their skin has many problems, and this is why it's giving it that unclear look. Now, if we go back to what you can do now, the first thing is that you need to understand if we're just talking about, reaching that glow for the skin during this quarantine time. The first thing you need to understand or to know is, what is your skin type? because
Okay,
that's
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 great. Okay.
that's gonna put you in a category, and this
Mm-hmm.
category is gonna, you're gonna know which products to, because if you're not, if you're not under medical supervision, then when you go to the pharmacy, what are you going to choose? Or if you're
Yeah.
looking online, what are you going to choose? So that actually puts you in a category, so you can focus on that category. Okay.
Okay.
So the skin types are that oily skin, you have combination skin, you have normal skin, you have dry skin, sensitive skin,
Yes.
and
Okay.
then you have the problematic skin. That means the people that have acne, rosacea, eczema, or whatever is going on with their skin other than their skin type.
Okay,
Now,
because I thought the acne skin is oily skin, or it's
not
considered
necessarily,
problematic. Hmm?
not necessarily. You can have oily skin without having acne, but you're prone to acne.
Okay,
Oily skin is always prone to acne, but you can have oily skin
oily
without
without
acne,
acne. Yeah.
which is
Okay.
not very common, but because oily skin you can address it alone, but acne needs a totally different different skincare
Okay.
for that problem. So this is the first thing I try to tell my patients or tell the people online, like on social media. If you don't know your skin type, then you're going to start using things that are not suitable, and instead of having good effect or getting the
What if,
benefit.
for example, someone like used like she has oily skin and she used dry or set for sensitive skin,
That's
like
true.
creams for that.
Yeah, that means she's gonna clog her pores for sure. It's
So
oily
it's
skin
gonna affect her in some
in a
way.
in a in a in an adverse way. Because once you start using oily skin treatments for like oily skin products for the dry skin, you're gonna increase the dryness, because usually oily skin skincare is targeted towards decreasing the oiliness of the skin. That means you're
Yeah.
trying to dry it out basically. But what
Yeah.
you're trying to do with the dry skin is that you're trying actually to moisturize it. So you're trying to make it more oily. So it's totally different skin types.
Hi.
And using
I'm just signing Diva. Hi.
oh
Okay.
hi, how are
Okay,
you? It's good to
continue.
see you here. So yes, that's the most important thing, knowing your skin type. Once you know your skin type, you can be targeted when you're trying to choose. So that's basically it. Now, if you have a problem, this is the first thing that you need to address. Like if you have a skin problem, then that's the first thing you need to do, because no matter what you do or no matter what kind of skincare you're going to use, it's not going to work, because that problem is going to continue being there, and sometimes you can even flare
Yeah,
it by not addressing it. For instance, acne is the biggest problem that we
of
have in
course.
the
Yeah.
clinic, and because it actually affects 80% of the population anyway. So, that's a big chunk of people having acne. Now,
Really, 80%. Wow.
yes, yeah,
Okay.
especially, yeah, it actually
That's a
continues
big
in
number.
women. And that's why our clinic is always full with acne patients. And that's
Yeah.
most of the questions that are there on social media.
Mm.
When they have acne and it's not addressed, and they just go on, using different products, the acne is going to still be there. The acne is not going to be treated. Sometimes it gets worse
Mm.
because it's not being addressed. So,
Okay.
if there's a problem in the skin, you have to address this. And this is the same technique that we do in the clinic itself. I have to address the problem first. I mean, she's telling me I need to be looking brighter. I need the pigmentation to
So
go,
you're
but then
saying
there's
we cannot
acne
like,
sticking out. Sorry?
okay, sorry for interrupting you.
No, no, no
So
worries.
you're saying I cannot like achieve glow if I have acne. Hypothetically speaking, I have acne, so I cannot achieve that glow if I have acne, right?
Yes,
So I
because
need to
there's a
treat it
problem.
first,
Yes, definitely.
or it can be achieved.
No. If you notice, a lot of people when they have acne, they try to cover it up by, like, that's the problem that I see when they come to the clinic. They have acne and they try to cover it up with layers and layers of
Foundation,
concealer
yeah,
and foundation
that's it.
and everything, and this is one of the problems. It's like you're trying to wean them off, putting all that
Yeah.
makeup in order for us to be able to treat the acne. So usually, patients don't see their self glowing no matter how their skin is, if there's acne. And even
Okay.
people's perception of them is that they don't have glowing skin if they have acne. Okay, and that's
Okay.
why it's one of the problems that you need to address. Also, if they have rosacea, the color of their skin is not going to be it's not going to be unified. It's going to be distorted because they have
You mean
redness
like
and
discoloration, you're saying?
they have discoloration. Their skin is going to look red and blotchy and overly pink. And it's not going to be all over. It's going to be in patches elsewhere. So that's the only thing that the people are going to see, and that's the only thing that the patient is going to see. So if we don't address that, it's going to continue on not giving them a glowing skin. So this is the first thing that people need to do, is that they need to treat the problem if there is.
First.
Now,
Okay.
if
That's
they don't have a problem and they just
like,
have like,
let's say they don't have a problem. Okay.
yes, if they
That's
don't have a
the
problem,
other category of people. Okay.
if they
So
don't, yeah, so if they don't have a problem, they just have to use proper skincare. That means they don't need to treat anything. They just need to take care of their skin. And it's basically just different steps. It depends on the person. I like to modify it according to the person's lifestyle. So if the person doesn't like to take a long time in taking care of their skin, that means we try to choose things that are multifunctional. That means like one serum would give you different effects. And all you need is a cleanser and a serum, and then you put your sunscreen on and you leave. Now, there's a big trend with the Korean products. So the Korean way
yeah.
of taking care of your skin is actually from 10 to 12 steps just in the morning, and then 10 to 12 steps at night. And some people are really into that. And then, they have different layers of skincare that they apply. Though the thing that I always tell my patients or my followers is that when you're not taking care of your skin properly, it shows. Once you start, taking
True.
care of your skin properly and doing different steps when you're doing it, it's actually going to start showing from week one.
Okay. So like you have like special routine. I know that people usually have special routine in the morning, and even at night they have to like put a different creams.
Yes.
So if they don't put it on a daily basis, or for example one day they put it, the next day they don't, it's not gonna show a good result. Because
Uh,
sometimes we forgot, but we need to like be continuous with the treatment as much as possible.
I
Yeah.
one day is not going to make a big difference. Like I mean,
One
a lot
day.
of us,
Okay.
there are certain things that they're totally for me to tell patients or to tell the followers no. But other things, it's like at least just wash your face. But no, if you miss one day or 2 days, it's not a problem. But if you start missing weeks and months and things like that,
It's
and
gonna
you're
affect.
just doing the minimum and you're not really trying to boost the skin or apply antioxidants or anti-aging or things like that, then your skin is not going to look the same glow as people who are actually taking care of their skin. So if you're on a regimen and you miss 1 or 2 days, it's not a problem. But if you're not taking care of it at all, then
Of
then your
course.
skin is not going to it's not going to look as glowy as someone who's actually taking care of their skin on a daily basis and on a weekly basis, because there's daily things, and then there's weekly things that you can do, and there's monthly things that you have to do for your skin in order to to keep it glowing.
Okay, so what are the daily things? Like, is like putting a moisturizer and a cleanser, and then is it enough? And toning the face, or there are other extra? I think that's enough, right? For
It depends on you. Like I said, it depends on the person. But I have very basic, and then we have more steps. So
let's
basically,
take
for
for
instance,
example, you want to like address all the types, or let's say the normal skin
no. In general, like
in
all the
general.
types,
Yes, in
in
general.
general,
Okay.
all the types they need certain things. Okay, and we're just gonna add to certain types like an additional step. So basically,
Steps.
all skin types they need to cleanse their skin, and they need to choose a
Sure.
cleanser that's actually
Based on their type.
suitable and the skin type. Yes, exactly. So this is number one. So a cleanser in the morning and a cleanser at night. Now, if you're applying makeup at night, you really need to add, the removal of the makeup step, and then afterwards you do the cleanser, because you need to remove also the makeup cleanser. Okay, so this is the cleanser part. Now, in the morning, the least that you can do is that after you wash your face. Now, the toner is an addition. If you want to do it or you don't want to do it, this is up to you.
Really, I
But
thought it's like it's not so a necessary step.
it's not the most important step, but if it's added, it's actually beneficial. But if
Beneficial,
you're
yeah.
not going to add it, then it's not the most
Like it's not
important
gonna
step.
affect.
Yes. So if the minimum that you can do is actually wash your face, and then the second part, I like that patients always use some sort of eye cream.
Yeah,
Depending on the time. So if they're young, they use a moisturizer or something with hyaluronic acid.
yeah.
If they become in their 30s, they should, use something more of an anti-aging, like something that has retinol in it. And then as they grow older, they need more stronger treatment. So an eye cream is a must for all ages, and especially after 20.
Of
So
course.
this is the second step. Cleanser, the eye cream, and then a serum. Okay, this is for all skin types. You just need to use the serum that your skin needs.
What
So
type of serum, in your opinion? I know there is vitamin C, I think.
vitamin C is one of the popular ones. It's actually also still one of my favorites.
Okay.
I still like vitamin C because it's a strong antioxidant, and at the same time, it promotes the function of the enzymes that form collagen, which tightens the skin. And also, it brightens the skin. So if you have some pigmentation or things like that, it actually helps you to give a brightness to the skin. So to me, vitamin C is one of the most important serums to use at any age. So I like to apply it in the morning. And then afterwards, this is when it changes. If you're oily skin, you don't need a moisturizer unless you're using acne treatments, because acne treatments dry your skin and you have to use a specific type of moisturizer for acne prone skin. But if you're
Okay.
oily and you don't have a problem, all you need to do is the next step would be, if you're going out or you're sitting in front of your computer now, a lot is actually that emits
Okay.
from the computers is actually also giving the effect of
Yeah.
UV light. So you have to be careful from that. So apply the proper sunscreen. If you're oily skin or acne prone skin, now we're very lucky. Before we didn't have this. Is this sunscreen specific for acne prone skin? And most of them sometimes also now have within them treatments for acne. So it helps you to block the harmful effect of rays, at the same time treats your skin, at the same time a little bit of moisturizing effect that doesn't clog your pores. So this is to
Yeah.
me the minimum steps that you can use.
The minute.
The minimum, yes, in the morning.
Okay.
Okay.
So you highlighted a very important point, which is using like sunblock or sunscreen while you're using the computer, because a
Yeah.
lot of people think we need to be like in the sun, but actually the computer has like this
Rays,
is
exactly,
and
which has the blue light. And now there's emerging يعني في ابحاث هنا طالعه انه بدات يبين انه في تاثير لهذه الريز, the blue light on the skin, the same effect that you can get from the sunlight. The
wow.
harmful effect. That's the harmful effect, not the beneficial effects. يعني. So
Okay.
yes,
um so this is like the products that you can use on a daily basis. Is there like, let's go on into the clinical procedures if people wants to go the extra mile and
during the quarantine time, if we're going to talk about the quarantine time, because if
yeah,
it's
after.
yeah, no, because I would like people to actually benefit from this time during,
Yeah, of course, of
being
course.
at home. So this is the best time for people to actually address any problem that they have. They're not going out more. They're not going in the sun more. They're not, being exposed to other people because of the social distancing.
Yeah.
So basically, even if there's, their acne is showing or their rosacea is showing or everything, they don't have to cover it up anymore, and they can just liberally treat their skin. Now, some of the procedures have been emerging during the quarantine time. I just spoken today about one of them is actually doing some sort of chemical peel, but safe at home by
Yeah,
using,
how can we
different
do that at home? That
the
is
no, because I'm thinking that
it
I did like
possible
a
to be
whole,
done at
like
home?
a 30-minute talk on that today. No, basically you choose the simplest thing that I like. I'll just, simplify it. So basically, if you haven't used any kind of chemical peel before on your skin and you want to venture into trying to do it here at home, first of all, people who have sensitive skin or have, rosacea skin, they really shouldn't be using any kind of chemical peel because it's going to make their skin worse during this time of the quarantine, especially that there's no, they don't have medical supervision. But anybody else who wants to do, a chemical peel at home and it's their first time, they should use things between 5 or 7% glycolic acid. And they shouldn't really go higher than that. And they should do it gradually. So basically, they can choose a cleanser that has a glycolic acid peel, and they can use it on a daily basis starting at night. And then if they're responding well to it, they can start doing it twice a day, like in the morning and at night. Now,
Okay.
I don't like them to use it for a long period of time. I like them to use it for a specific period of time where they're
The
gonna get
chemical peels.
like they get an exfoliation, like they get the chemical peel. The target is to remove the dead cell, the dead skin on the top layer of the skin, because during quarantine you're not going to do a deep
Deep
peel for sure.
peel. Okay.
Yes, you're just going to do a superficial peel. So if you haven't done anything before, you can choose a cleanser with 5% to 7% glycolic acid. There are some serums online that I have been seeing, and I actually spoke about it in one of the posts that they have, and they can use like certain pads or certain, serums that they can use. It's between 5 and 7% glycolic acid, and this is going to cause them to just remove the dead cells of the skin. I don't prefer that they use it for a long period of time because it's going to make their skin sensitive, and it can
Okay.
actually switch their skin type.
So how
Um,
long? Maybe like twice a week, or
no, it depends on how
it
much they want
depends.
to do. Yes, if they want to do like a real on peel, like they want to see exfoliation, as long as
Mm.
you don't harm your
Just
skin, you can do it for 5 to 7 days, and then you
okay,
can take a
but
break.
not
I like
longer
doing it
than
in
that.
cycles. Yes,
Okay.
and then you can take a break, and then afterwards, you can do it like every month or every 2 weeks, depends on
Mhm.
your needs.
Yes.
Now, if they are people who are used to using, glycolic acid cleansers, and they're used to doing some sort of peels, then they can venture a little bit more, and they can go into 10%, and they can go into, if you're from 5 to 7 to 10, then you can just stop at 10. And you can use that also. It's like a cleanser. You can use it at night for several weeks. When you get exfoliation, you can stop, and then you can repeat the cycle some other time, or you can use it intermittently during the week, like 3 times a week at
Okay.
night, and that just keeps you in a, like an exfoliating state. Now,
Effect. Okay.
yes, or there are some pads there are some concentrations above between 10 and 15. Now, at 15, you have to stop. I don't like what I've seen on the internet where there's up to
Uh,
30%.
are they like pads? Like you put it on your face, or
It depends. There's one that I actually talked about today, and I'm not sponsoring that product,
no
but
problem. Okay.
but it was like 15% glycolic acid. So the 15% glycolic acid, it's like a foam, and this is something actually we use at our clinic before we do glycolic acid procedure, so they can apply it. They can leave it between, if they're not used to it, between 2 minutes, and then the week after 3 minutes, and then 4 minutes, and then 5 minutes, and then they can wash it off, and they need to wash it off totally, and they can use it to do like an at-home peel treatment once a week. and they can do it for a long period of time until they get the effect that they want, as long as it's only done once a week. Now, some people need a little bit more.
Then once.
Basically,
Okay.
yeah, like people who have comedones, people who have a lot of wrinkling, people who, have a lot of imperfections, and they can do it twice a week. Now,
Okay.
you have to be careful. Once you start feeling that your skin is always burning and it's red and itchy and stuff, then you need to totally stop doing any kind of peels in order for you not to hit like a stage where it becomes too inflamed and then it becomes pigmented and you're getting adverse effect instead of positive effect. So yes, you can do up to 15. Now, I've seen on the internet concentrations that are 30% glycolic acid. I don't recommend, skin
This.
types in Saudi to do that because um, they're more prone for pigmentation. They're more prone for what we call post-inflammatory pigmentation. So they can,
Okay.
if they get too inflamed, they become pigmented, and that becomes a problem because it will last 3 to 6 months, and they'll need additional treatments to remove that. So I don't recommend anybody who has ethnic skin to do more than 15%.
What's
It's basically
what's
it's
the
a
ethnic skin?
terminology that we use in dermatology.
Okay.
Our skin types are the color of your skin is divided into Fitzpatrick color. So there's 1, 2, 3, 4, and 5, and it ranges from 1 to 5, where 1 is very light skin. So
Yes.
and
Okay.
then 5 is like dark skin.
The
So
medium. Mm.
yeah, so basically skin types in Saudi, most of the ones that I see
Are
are between three and
between
four.
medium and beige and
Yes, three
yeah.
and four, and this is what we call ethnic skin.
Ethnic. Okay.
Yes.
Okay. So what about let's go into the diet. Is there a special diet that we can use to make our skin like more glowy?
Definitely bad diet, and this is what I tell all my patients. If you're on a bad diet, it's going to reflect on your skin because you're going
Okay.
to become more oily. You're going to have because it's going to cause inflammation in your body, and hence it's going to cause inflammation on your skin.
Okay.
So bad diets in general, like high sugar content diets, high fat content diets, especially if it's not the good diet, like it's not the good fat. Okay. Now, anybody who for skin in general, anybody who has good amount of fresh fruits and vegetables is usually have much better skin than people who are on not so much, like if they're basically only taking carbohydrates and meats. Their skin is not going to be as glowy as people who have a better diet, and it's more controllable. It helps us to control more the skin problems, but not specifically towards something. Like some people say, there's so many myths regarding certain
Yeah, of
foods.
course. Especially in
Yes.
skincare, there are many myths. Yeah.
Yeah, so there's so many myths. It's like, no, if you eat this, it's not gonna. There is
Yeah.
some science behind that, but in general, I like to tell my patients to eat a lot of citrus food because vitamin C is always good for your skin,
Okay.
and a lot of red leafy vegetables. For the hair, it's very important to get your protein
Red
in.
leafy vegetables.
Green
Green,
leafy.
green. I heard.
Sorry.
I didn't hear correctly. Okay. Yes.
I
Green
probably
leaf. Yeah.
mispronounced it. Green leafy
Okay.
vegetables because they're good for
Yeah.
your skin, and also don't forget you still need your meat because of the hair, because your hair needs it. So that's important. As long as you get the good amount of zinc and vitamin C in your diet, then and vitamin D, then you're good.
If there is, let's see if people have questions here. Let me scroll down and see.
Sure. No
Okay,
problem.
nowadays by washing our hands a lot, I feel it becomes dry
Yes.
between the fingers. What advice we should take? That's
Yes,
a
this
good
is a
one.
big problem. It's actually this is one of the first topics that I addressed when I started doing the live chats on my Instagram live, because I got this complaint from a lot of my patients, and actually from my own mother. here at home because we're excessively washing our skin. When we wash our skin, it's still important. So we had to go into what the American Academy of Dermatology actually advised us in order for us to be able to give proper advice without, causing harm. This is what needs to be done. So basically, when we're washing our hands, we're not just removing, the way the hand washing works is that you're actually breaking the lipid that protects the virus, okay? Because it emulsifies it. And at the same time, we have protective layer of fat on top of our skin. And this is actually helps us in order to keep, the things from the environment going in. So when you're washing your hands, you're actually also you're removing that fat layer in a way. Now it gets worse with using sanitizers. The alcoholic sanitizers are worse because they cause something
it makes
called
your skin, I think, more dry or dry.
Yes, it causes a condition called contact irritant dermatitis. Basically, it goes into an eczema state. So as much as we can, we advise that you only wash your hands with, as much as you can. If you're able to wash your hands, it's much better. Washing your hands is much better than using the sanitizers for the sake of skin health. Okay, but if you don't have, access to hand washing, still the virus is more deadly than dry skin. Then you can use the alcohol sanitizers. Now, the best thing to do after you wash your hands is dry them. Okay, so dry and don't leave the cracks of the fingers wet, because that causes more dryness actually. The second thing that you need to do.
So you're saying we need to really dry our, not to leave the middle of the fingers.
Not to leave it moist, yes, because
moisty. So it needs to be completely dry.
Yeah, because when it air dries, it causes you to be more dry actually. So that's number one. The other thing is that you need to choose a hypoallergic cream. So basically, there are some brands out there that I'm gonna say, because these are the brands.
After the washing or
after you wash your hands. So basically, you need to moisturize after, because you need to replace that lipid layer that's been removed with a moisturizer. But you don't need, but you need to use proper moisturizer. Hypoallergic.
Hypoallergic cream.
Hypoallergic.
Good. So people can search for that. Okay.
There's many ones. Okay. So, and you don't need to use a lot. I had actually this question to one of my colleagues who was actually giving a lecture on using. You don't need to use a lot, because my concern was that if you're putting a lot of moisturizer, then it's too sticky. Your hand is too sticky, and you're touching everything, and you might be just worsening the transmission. The thing that you need to know is that you use minimum amount, so a pea size of a thick moisturizer, a hypoallergic moisturizer, and you apply it evenly on the hand. So as long as you have a thin layer on top of your hand, then you're totally fine. It's just going to get absorbed, and it's not going to cause a problem. So this is what the American Academy of Dermatology recommends that we do, that you use a hypoallergic moisturizer, and you don't need to use a lot of it, but use it every time you wash your hands.
Okay, perfect. Thank you for your response. Let's see if there's any questions. If there's any questions you can ask. Let me see. What else? Because I was seeing some people commenting, but okay. True, I would have. Someone saying she wishes she has laser resurfacing this time. Okay. Okay. So if you have any questions, you can feel free to ask.
For the laser resurfacing, lady, at the time, like I said, you can actually use the.
I think we have a couple of questions here, but you can continue.
At home chemical peels. I actually did a whole post on it yesterday, and I talked about it today, so they can just check out the account, and they can benefit from that.
Okay, let's see here. What can we do for dark circles under the eyes? Yeah, that's a...
Okay, so dark circles in the eyes is actually two things. So basically, one is the genetic factor, which actually it's pigmentation.
Okay.
Okay, so you need to use something with an anti-pigmentation around it. And there's also some leakage of the small blood vessels in this area, and they deposit something called hemosiderin. And for that, usually the key is to use an eye cream with a vitamin K base. So in order for it to burst all those hemosiderin. So usually if it's the genetic pigmentation, the darkening, it's actually a pigment, not the hollowness. Then I advise two creams. One cream has a lightening factor, and then the other cream has a vitamin K factor. And they use it one in the morning, one at night, and they need to use it for at least 3 months before they give up on it. And they start seeing effect after 1 month. Now, if it's a hollowness, and this is, a shadow effect, then the only treatment is doing a filler.
Okay, so if they have like if it's very indented, they need a filler. But if it's
Yeah, because
normal,
that's a
like dark
hollowness. It's
circles,
not a
they
pigmentation.
can
It's a
treat it.
shadow. Yeah, it's a shadow effect. So that
Okay.
needs you need to push back that hollowness upwards, and
So
by
yeah,
you
so
do that
that
by
cannot be treated by creams. They need
no,
to.
that cannot be treated by creams. Yeah.
Okay. So, but anyways, that was all for today for having a glowy skin, and thank you so much for watching.